Hickner at the Family Health Clinic. For our 25th anniversary, we're interviewing staff and community members to explore what the Family Health Clinic means to them. In this video, we're interviewing Barb Strasburger, who has been with the clinic for a long time. Barb, will you please introduce yourself and tell us what your role is at the clinic?
Sure. So I'm Barb Strasburger, and I'm a family nurse practitioner, which a lot of the people in the community have met me because I've been there since 2001. I actually was there the year before as a student, but I graduated from Purdue in 2001 and was fortunate enough to be able to work in Delphi. And I've worked there until 2017 when I retired. But we started out just a little tiny clinic. We grew to 4 big clinics.
So what other growth and how have you seen the clinic grow?
A lot. So
many years ago.
Yeah, well, before my time in the 90s, in the late 90s, Deb Mears was there, and they had a little clinic on Main Street, just a little storefront. They started seeing patients, and it was a lot of nursing visits, blood pressures and that kind of thing, wellness checks. But then we started hiring NPs that had graduated from Purdue, and we then moved to the Brosman Center on 421, and that clinic was housed in the old Branch Bank building there. So we were able to expand to 3 exam rooms. We had 2 nurse practitioners at that time, just 2, myself and Jenny Coddington. She was pediatric and I was family. And we stayed there for quite a while. But what happened to help us expand was we were getting funding from the state as a safety net clinic, and they told us that we should expand our funding. So we applied to get rural health clinic designation, which we got. That helped us grow a lot because we got additional funding. And then the state told us, we have a lot of community health clinics and we're having hard times funding all of them. So you need to look for other sources of funding if you want to stay sustainable. And so we looked, of course, to the federal government, which is where a lot of grants come from. And we applied to become an FQHC, which is a federally qualified healthcare center. It's kind of a hard designation to get. There was only one other one in our area, and they had to, endorse us. And so that was Riggs Clinic in Lafayette. So they did endorse us. We became a family health clinic. a FQHC, a federally qualified healthcare center. So that brought in a lot of funding. And so we were able to hire more staff. We were able to get a administrator, which at the time it was just myself, Deb, and Dorothy. So we were the administrators. And so we got administrator, we got a business manager, we were able to hire more NPs. And before we knew it, we were making ourselves visible. And so the North Central Health Services offered us money to build a new clinic. And that was huge for us. And so moved into our new clinic, gosh, I want to say maybe 2005. Somewhere in there, but now we've had like 9 exam rooms. We hired more NPs, so we had like 5 or 6 of us. So that really was a big growth for us. Then we decided, when they came out with patient-centered medical home, we decided we wanted to do that as well. And that is really a designation that ensures quality for our patients, which we really wanted that. So the patients come first, their welfare comes first, and so we do things like same-day appointments for our clients, so they don't have to go to the emergency room. That's our whole focus, is keeping them out of the emergency room. And so that brought additional funding, but it also brought higher standards we had to abide by. So now we have a patient portal for our patients. We have quality measures that we have to meet, which entails, making sure our patients get the services that they need. So that's all really been growth over the last, I'd say, 17 to 20 years. Yeah.
And what impact have you seen all of those changes have on our community?
Well, we serve all income levels, all ages, so from birth all the way up through Medicare, so the entire lifespan. So I think we've really made an impact in our community because we've been able to improve the healthcare in our community, not only in Carroll County. Because we really were drawing from a 15 county area. So we've improved the health in our community. We've done a lot of education, trying to get people to understand why they needed health insurance, why they did not want to use the ER for their primary care. And I feel like we've made a significant impact, and we are very convenient for our patients who just want to come in for a quick acute visit, like if they've got an earache or a sore throat, they can pop in. They don't have to go all the way to Lafayette. We've got sports physicals. I mean, just I could go on and on the different services we provide, but we've made it very, very convenient for our patients. And now not only in Carroll County, but in White County, because we have 4 clinics now, 2 in Carroll and 2 in White. And I think they come also because there's a lot of local staff. And so we not only provide jobs for people in our local community, but also it's familiar faces. So when our clients walk in, they don't see strangers. They see a lot of people they already know. I think we're very approachable. We're very welcoming. And I think our clients feel comfortable coming to us.
So what does being involved with the Family Health Clinic mean to you?
Well, I feel like I'm giving a helping hand for those who need a hand up. I really liked working with the population that we work with, which are often uninsured, underinsured, working people who just are trying to make ends meet from paycheck to paycheck. So I really feel privileged that I've been able to work, with the people of Carroll County and White County. We do a lot of things to help out in our community. Thanks to Barb, we have community outreach. So, we've been able to participate, in food drives, food pantries. We have a Christmas stocking fund to help our community out. Even the participation in local events, the fair and local events that we put booths in. I think all of that's been just wonderful. And I really have enjoyed, being a part of it, not only the growth of the clinic, but also the impact it's had on the community. So I feel really privileged that I've been able to work there.
Good, good. So one last question, Barb. What's one thing that you want the community to know about the Family Health Clinic?
Well, I think they still are not fully aware of all the services that we offer. And I want to just tell them to come to our clinic, come and check it out. Check out all the services that we have available. I think they'll be surprised how much we have to offer. We've got NPs from all walks now. We've got pediatric, we've got women's health NPs, family, adult, and so we've got some geriatric specialists. So I think they'll be surprised at how comprehensive our services are. And of course, our wonderful staff. They're always so helpful and friendly. So I think that's what I'd like to tell people is come to the clinic and check it out, because I think we have something for everybody.
Great. Barb Strasburger, longtime nurse practitioner with the Family Health Clinic. Thank you so much for your input and information today.
You are so welcome.